Good evening, ladies and gentlemen, Director, Rector. Apologies in advance that my German is still not good enough to do this talk in German. I'm a Brexit refugee. I've been here a couple of years. I'm extremely grateful to Austria for welcoming me so much. And I apologize that it'll be in English. The slides will also be, they're in German though, so we'll try and see how this goes. So as Thilo said, I'm a psychologist, and I'm particularly interested in how climate change affects people's mental health. And I'll talk you through over the next 5-10 minutes just a little bit of the evidence that we've been looking at here in Austria and around the world about what's likely going to happen, and in particular how the green spaces, the blue spaces, the nature in the city can help reduce and mitigate the negative impacts of climate change on a range of health and mental health issues. The first thing to think about is that health, when you talk to medics, increasingly the science is fantastic, right? We're in more and more every day understanding genetic determinants of health. You're also all aware of proximal determinants of health, what you eat, your sleeping patterns, are you getting enough physical activity, what are your social relationships like? That's also all important for health, of course. Do you work too hard? What's your social networks like? What are the buildings you work in? Are they good for your health? But also beyond that, further determinants of the natural environment and the whole ecosystem we live in. If the ecosystem fails, as we've already heard so far, all of our health is threatened. So we see these determinants of climate change, global ecosystems, natural environments embedded within urban systems as crucial distal determinants of our health. And that's what we're trying to look at in the research we're doing as part of the Environment and Climate Hub. And what we call these green and blue spaces that could help mitigate or reduce the impact of stresses of climate change, in the terms the EU uses, are nature-based solutions, or naturbasierte Lösungen in German. We've already heard a lot. I don't need to repeat at this slide. There is going to be increased heat here in Vienna. That's very, very clear. There's a fantastic document, and I echo what Professor Hoffman said. The Stadt Wien has done an awful lot of work trying to work out how we can reduce some of the impacts of these increases in urban heat, and that will include a lot of urban greening. And it's not just things like street trees, it's not just things like allotment areas. These are all important, but what's absolutely crucial is the interconnected network of these things. They need to be joined up, not least so that air flows and temperature flows can move around the city in ways that reduce the urban heat island effect, especially in the poorest areas of the city, because we know the richest people in the city already live in the greenest areas where the temperatures tend to be lower. So the plans are also careful to think about social equalities across the city. But it's also not just increases in temperature that are threatening us from climate change. As you all understand, also there will be more extreme weather events, including more extreme rain, and that will lead to flooding. Now again, Vienna's been very prepared, as has Austria, for flooding events for many, many years. And in fact, as the EU, the European Union, talks about nature-based solutions as a new thing, actually Vienna has been doing nature-based solutions for at least half a century. Of course, you'll all recognize this place. This was it in 1972. At that time, it wasn't an Insel at all, it was a floodplain. But over the last 50 years, of course, Vienna has turned this space from a relatively barren area, now in 2023, to this rich green and blue space. Now that's important because it reduces flooding, it's important because it helps reduce temperatures, but it's important for another reason, and that was written in as early as 1972. Vienna's planning system was way ahead of most other cities, and in fact people from around the world come here to learn about your green and blue infrastructure and how they can replicate it elsewhere. The major advantage, the other advantage as a psychologist, is that people use this space to recreate. They go there to exercise, to walk, to cycle, to skate. They go there to swim. They meet friends and family. They go there to barbecue, to grill across different ethnicities, different groups. Everyone visits this place. Now, as a psychologist, yes, the temperature is important, the flooding is important, but those social bonds for me are extremely important. The relaxation that we get when we visit places like the Donauinsel are also extremely important. As the general director said, there are psychological benefits from spending time in these places. And I mean, that's already enshrined in the Sustainable Development goals. So for example, number 11, which focuses on urban settings, is to make cities and human settlements more inclusive, safe, resilient to things like climate change, and more sustainable. And Target 11.7 speaks to this explicitly. It says that we need to provide access to safe and inclusive green and public spaces, particularly for children, older people, and people with disabilities. Now, Vienna is doing quite well. Across the world, 3 in 4 cities have less than 20%, even though the target is 45 to 50. Vienna, according to Statistics Austria, is around the 31%. So we're doing very well, but we could do even better. And it's about how we can work with urban planners to make our cities even more greener, to meet the kind of sustainable development goals that we've all signed up to. Now, just a little bit of evidence that this is true. This is data collected across 19 different countries, including Austria. And I'm not going to go into this in great detail, but down here we look at the number of visits people make to green spaces, like the Donauinsel in the last 4 weeks. And here we look at the World Health Organization. The WHO is the World Health Organization. Psychological well-being, according to the WHO. And what you can see here is a fairly linear trend. Countries where people visit green and also blue spaces, I'm not going to show you all the data today. People who visit, countries where people visit green spaces more have higher well-being. It's not just a country level effect. We see it at the individuals. Again, we've looked at over 18,000 individuals. We monitor people over time. When people spend more time in green and blue spaces, their mental health improves. When they reduce that time, their mental health goes down. And what's really, really important for me is that these benefits actually benefit the poorest in society most. The rich people in the city, and to be honest, that's probably most of us sitting in this room, we get some benefit from these spaces, but generally speaking, our health and well-being is already relatively good. It's the people in the poorer areas of the city that benefit the most, because in general, there are health inequalities in Vienna like every other city. Actually, they're not as bad here as where I come from in the UK, but those benefits benefit the poorest the most. So this is data we've been collecting here in Austria for the last couple of years using representative samples around the whole of the country. And I just wanted to show you a little bit of data, again looking at the World Health Organization measures of mental health and how that's related to the income of the family of how we collected the data. So what we've got here on the bottom is, it's called equivalized income in tens of thousands of euros. Basically, this is a technical term that's used in economics, but the poorest people are down here and the richest households are up here. And what I want to show you is that generally speaking, well-being goes up as income goes up. That's a well-established finding around the world. But the important bit now is, what about recreational visits to green space? So if we look up here for the richest, it doesn't matter how often they go to recreational visits in green space, be it 8 times, this is over a 4-week period, or up to 44 times. These are generally dog walkers, right? The people who visit green spaces most have to do it twice a day to exercise their dog. The important point for today is that the benefits of visiting recreational green spaces are amongst the poorest. So what you see in that blue line there is the health and well-being of the poorest in society is almost the same as the richest if they visit these green and blue spaces frequently. So therefore, it's not just about, it's important to bring down the temperatures for everyone, but supporting the poorest in community access these places, making sure they're near where they live, can reduce health inequalities in the city, which benefits everybody. And actually, we can be even more targeted than that. So as part of a large European project at the University of Vienna, we're coordinating across 14 countries across the European Union and coordinating with Canada, America, and Australia. We're using nature-based therapies to target some of the most critically vulnerable in society, people with various disabilities or psychological needs, to do various levels of interventions involving natural environments to promote their health and well-being. We know that as temperatures rise, people gravitate more to the parks and the blue spaces. I haven't showed you that data today, but these places are going to become even more important to the vulnerable in society as temperatures rise. And the latest work we've been doing was with the Austrian Red Cross, who were really interested in how to support older citizens, people in retirement age, access green and blue spaces, particularly for forest therapy, in Austria to try and reduce the impacts of heat stress on the older population, as we've already heard. And we've been working with the Austrian Red Cross and the Bundesministerium to develop protocols to support mayors across Austria, support the local communities, in particular older people, access these spaces. So in a nutshell, the take-home message, yes, it is important that we green our cities to reduce the impact of climate change because that will benefit all of our health. But also, it's not just about changing what's out there, it's about changing how we access it. And in particularly for our mental health, targeting the groups who are most vulnerable, who don't have so much access, to support them, because that's where the biggest health gains actually are. And finally, the European Union is actually investing a lot of money across the whole continent to try and work out how we can use these spaces to better support the absolute most vulnerable in terms of certain group-based, nature-based therapies. And with that, I'd like to say vielen Dank für Ihre Aufmerksamkeit and for your patience with my English. Thank you very much.